Okay. Welcome back, everyone, to another episode of Haitians in Medicine. I am your host, Nehemie Auguste, and today we have student physical therapist, Miss Yrline Seraphin. All right, Yrline, go ahead and introduce yourself. Let the world know what is it that is your occupation, and what are you working towards?
Hi, I'm Yrline Seraphin, or Yrline Seraphin if you want to do the curl way. I'm currently a student physical therapist at Ghana University, and I'm in year 2. So I have one more year and then I'll be done.
It's a DPT program, right?
Yeah, it's a doctorate of physical therapy program.
Yeah, because I know that a lot of physical therapy programs, they're transitioning out of master's programs, and like most of them are becoming doctorate programs.
Yeah, they did that transition. So when I wanted to become a physical therapist is when I was in high school. And that's when that whole transitioning process was happening. So like in 2010 era. So from there, like now before all you need was a master's degree, like an extra year in school and now you're done. And now you have to get like a doctorate degree because now they want us to we are like in charge of this profession. Like we are specifically certified to see people with injuries related to injuries and how we can treat them through using exercises and through using different manual therapy and techniques, so you don't have to like go to the doctor right away. Like you can come see us first and then go to the doctor if necessary. So that's why the main reason why they want us to become doctorate, because they want to put our profession in that type of category of specialties, like how you go to a special doctor for this special disease or this special treatment or whatever you need to be done. Now instead of just like going to that doctor for that specialty, maybe instead of think about them, maybe you can think about us and just be like, hey, I have like low back pain. Instead of going to a doctor and getting all my MRI images and all of that, let me see if I can go to physical therapy, save some money there, and figure out if I can do some exercises and do some manual therapy, I can probably treat this without spending X, Y, and Z money at like a doctor's office.
That's definitely understandable, especially it's more so preventative care rather than like treatment. So with going to physical therapy, let's talk about it. What is it that a physical therapist does for those who don't know what a physical therapist does and they only see what they see in the movies?
Sure. So physical therapy is all about movement and all about doing certain exercises and certain techniques to prevent either illnesses that may occur or to help you if you have like issues that are currently going on. And we only deal with like the musculoskeletal, so mostly like the muscles and like a few nerves, but we don't deal with like all the internal stuff. So we don't all the internal stuff, the blood and gory stuff, that you will go to a doctor for. But if it's like muscle related, you can come to us and we can figure out how to address that issue. Also neuro related, because there's a specialty in PT for neuro. So we can also like help with people who have like Parkinson's disease, Addison's disease, or any type of like neuro related type of issues. We can also help with that too, because it involves your muscle and something that we can do manual therapy with. But yeah, that's basically physical therapy. We just deal with like musculoskeletal problems, and we help people just get preventative or just, help lower the cost or lower the need to go to a doctor right away.
Definitely. So as a student, what is your role as a student?
As a student, so currently it's just learning the techniques and learning what I can and what I can't do, and also knowing when to refer and when to treat. So that's the main thing that you like as a student, because like you're thrown into this field, to this profession that you really, really want to do, or I really wanted to do. And I wanted to know okay, what can I treat and what can I treat? Because I want to make sure I'm doing what I can treat. I want to make sure
in the scope of practice, right?
Because you don't want to step on someone else's boundary. And we're all supposed to have this interprofessional network of relationships with all these other professions. So I don't want to do something that a nurse would be doing, or something that a special doctor would do it. So with that, it's just Just learning that, okay, this patient came in, this is the, like, let's say the patient came in for like low back pain. Okay, finding out how the low back pain happened, finding out what type of pain it is, finding out what type of activities produce that pain, doing certain manual therapy techniques to see, like, does this cause your pain? If this causes your pain, then that leads me down the rabbit hole of like, okay, let me try these maneuvers, let me try these exercises to decrease that pain. So it's just like learning about your patient, figuring out what that pain is, and then from knowing that pain, the goal is to make sure that pain not automatically like relieve, like get rid of the pain, because some people still might have pain, but lessen the pain to the extent that it's not something that will cause issue in your daily life. Like if you have pain that was like severe, you couldn't do anything, and like you came to physical therapy, and I brought that, let's say your pain was a 10, and I brought that pain down to like a 3 or 2, so you're able to like start doing things that you used to without that much pain. That's like my goal, or getting rid of the pain in general, but just finding ways and techniques to like help you get through your daily life without any pains or issues, instead of like going the whole other route where you could go to a doctor and then that doctor can do all these testings, all these I'll give you all these like what's it called, pills,
like Western medicine.
opioids, there you go.
Mm-hmm.
Give you all of that, and then spending all this money and not really seeing any results, and causing long-term issues in the end, because a lot of people who do go for pain, they always like go on like to opioids and tying on all of that, and that has been a big concern in this country of the opioid epidemic, and they're seeing that physical therapists can help play a role in ending that, instead of having doctors to prescribe medication, because that's what doctors are prescribed to do. I mean, like, hey, a person came in for this, I'm gonna do this, that, and a third, and if they still have pain, I'm gonna give them some medication, instead of just like, let me just send them to a physical therapist. Maybe that physical therapist can help them, so that person doesn't become, addicted to that drug in the end.
That's totally understandable. What are some things that someone who wants to be who wants to become a student, who wants to pursue physical therapy, what are some things that they should be preparing to do? Like if they're fresh out of high school and they know that this is their end goal, like to one day become a student who is like on their way to becoming a physical therapist.
So the good thing about physical therapy, you don't really have to have any type of like major regarding physical therapy. I mean, there's a lot of people that do exercise science, which is a great way to prepare you for the field. But when I went to school, I knew that I wanted to become a physical therapy, but I also had a backup just in case that didn't happen. So I just went for like a simpler route and just took extra classes. So I took, my major was like community health. So that's just like involving public health and all of that. And with that, I knew I had to take like all my science classes. Like I had to take like my chemistries, my bios, like my physics, like all of that. And then because I knew that, I kind of like strategized like my semester in like doing all the things that are required for my major. It's like 3 classes or 4 classes required for my major, and then 1 class required for like graduate school, because it's not that many credits. I mean, not that many classes you need. It's just making sure you pass all those classes within the time period that you allowed yourself to. So I will just like think about like what you want to major in. If you have a difficult major, maybe finding a way to take a few classes in that difficult major and then 1 class within that PT, regarding PT field. Or you can also do classes just like science-based related. So like with the public health field, what I did, all my classes that I had to take kind of coincide with my PT track. So that helped. Also, people who are like bio-related or something like that, they took classes and it kind of coincides with the track for PT. But I know plenty of people that did criminal justice and they just took extra classes.
No,
so
you're right. That's one big misconception that people have, that, oh, I have to go to school and be pre-PT for that, so that I can become a physical therapist. So with those things, like, did you use any specific thing to study for the GRE, or were you like, did you have like any PTA experience or any rehab tech experience to go like before you went in and got into PT school?
So when it came to rehab experience, I've always volunteered at a clinic for basically my entire life, because my entire high school life, because I was just like, I knew this is what I wanted to do. So I just when I had, and also I need volunteer hours. So if I needed volunteer hours, let me just do it in something I want to do in the future. So I volunteered at clinics. I saw what the PTs did and like how they maneuver, and like over the summer, I was just like, that would be like the thing I would do. I wasn't a PT aide. I wish I was, but my schedule didn't allow it.
That's
But
okay.
if I could, I think that would have been a lot more beneficial. What else? Yeah, I wasn't a PT aide. I'm sorry, can you repeat that? I didn't catch the last
I
part.
said,
What
did
was
you
it?
do anything like did you do anything else like to prepare for the GRE? Because I know it's not only
Oh,
grades,
DRE.
it's also
Yes.
like the GRE, which is the exam that people usually have to take for grad school, as well
Mm-hmm.
as like any other background experience, such as being a rehab tech or being a physical therapist assistant.
Yeah. So when it comes to the GRE, so I took the GRE, I studied, and I didn't do too hot on it. I'm not even gonna lie. I did like okay, but not enough for me to get like to like those top tier schools that I really, really that were like known for PT. There you go. And from there I had to like, sit back and rethink. I'm just like, okay, I want to become a PT. What do I got to do to become a PT? And that's when I remember going to my advisor, and he was just like, oh, well, there's some programs where you don't have to take the GRE, and they don't require a high score for you to get into the program. All you have to do is just take it. So I was just like, okay, I'll keep that in mind. So from there, I was just like focusing on having my GPA amazing. So I focused on having like a really high GPA. But my GRE, I was just like studying, doing the best I can, and I just applied for like schools that where they needed a GRE, but there wasn't a GRE requirement, or you don't have to take a GRE whatsoever. And that's how I came upon the school I'm currently in right now, which is Gannon. So
Where's Gannon located?
it's in Ruskin, Florida. It's like
I'm like, I've never heard of this school.
I know. They just okay. So the program actually is originally in Erie, Pennsylvania, and they just opened up a satellite campus to like Florida. So now they have like a program, just a program for like all graduate professions. So like physician assistants, OTD, DPT, SLP, nurse anesthesia.
Anesthetist?
Yeah, there you go.
Okay.
I always like get that confused, but yeah, like they have all those programs for like graduate professionals just here in this campus, and they just recently opened like 5 years ago. So since it was a brand new program, I was kind of like nervous. I was just like, I don't really know too well. I don't know if I want to do it, but I want to keep my options open, and also at the same time, I really wanted to get into PT school. So I applied for this one in USF, and this one got back to me more faster than USF. So I
Mhm.
was just like, okay, well, I guess I'm going here. And it wasn't too bad. I mean, like, I was happy because it was like, I had a decent GPA, which allowed me to get into the program, but also the GRE wasn't something that they required for you to get onto this campus. I mean, for you to get into the program. So I was just like, okay, well, thank God I worked hard in undergrad to do decent in my studies. But also, if you do want to go to a program that has like a GRE requirement, then I recommend just study, like get that textbook, do the GRE prep classes, get a group of people that are taking GRE around the same time you are, and you guys throw questions around each other. Because I know those ways help me out now when it comes to
Mhm.
like big standardized tests like that. But yeah, I didn't have to worry about a GRE requirement for here. But also, the volunteering and like the GPA is kind of what helped me get my foot in the door. And good letter recommendations. Those definitely help you a lot.
You definitely, and that's why it's important to network. What are
Mhm.
some things that, like, as a Haitian woman, that makes you different when you get there? Like, what are some things that you're finding out there that you can use specifically in our community once you're not a student anymore and once you do become a physical therapist?
So some things that I find out being Haitian woman and in my community as a student physical therapist, I can help other individuals that are Haitian and have a hard time understanding what the physical therapist wants them to do, or like speaking to them in Creole, or just showing them like what the whole process is. Because my mom, I've been like her translator, her helper throughout her entire life. And from there, I've noticed every time she went to a doctor's office or anywhere, like she wasn't really getting the full picture of like what they wanted to do, or she wasn't able to explain her symptoms. And then a doctor can only do so much. So if you tell them that, oh, you're feeling pain, but Haitians, they don't really like show like they have pain. They kind of just like, yeah, this came about, but like they don't really go in detail about it. So regarding that, I feel like within being a physical therapist in Haitian myself, I can help to my community that way, on speaking to them in a way so I can get the most accurate information, so I can diagnose them correctly, so I can make sure I don't miss something. Because I feel like if you miss something, that could cause like that rabbit hole of like referring them from here to there to there, and you have that whole theory of like, oh, well, I don't trust doctors because they don't treat whatever they don't treat me. They always just send me here, there, and like everywhere. So I feel like within that aspect, I can help speak to my community, also represent my community too, because there's not that many of us around here, and there's a lot of things like that kind of affect us socially within the Haitian community. Like when you go to a clinic, there's certain things that as a Haitian person, I know you wouldn't do to another person that's Haitian, but other people, there will be like, oh, they'll be like, so they'll be different about it. Like we have traditions and customs that we do.
Yeah, like you have to be very culturally sensitive.
Yeah, that's what you have to do.
Like we're a very big melting pot compared to the rest of the United States.
So because of that, someone that's African American, or someone that's Caucasian, they will probably do things inappropriately, and they'll probably like step out of their bounds, and they don't know because they don't really know too much about it. So from there, I can also guide my other DPTs and other staff that work under me, like, hey, this is how you approach this person, this is how you talk to this person, this is how you explain things to this person, and then like teach them the ropes so they don't like cross that barrier. Because you don't want that bad vibe, that bad connection when you first meet that person, because they're gonna already be like, I don't like this therapist, I don't like this person, I don't want them to touch me, and you don't want that.
Off real quick. They don't give you no second chances.
Nope, they don't. So it's just like, bro, listen, we got to get this right the first time. So let's talk about it and see how we can make sure that doesn't happen for the next person that we see, or someone that's also Haitian. Let's just try to talk to them and communicate with them respectfully. There you go.
So what made you want to be a physical therapist? Like, what was the turning point where you had the epiphany where you're like, this is what I want to do?
So when you're a child and your mom and dad are just always like, oh, you have to be a doctor, you have to be a doctor, you have to be a lawyer. And then for a long period of time, I was just like, I'm gonna be a lawyer, I'm gonna be a divorce lawyer. I don't know why divorce lawyer, but I'm just like, I'm gonna become a divorce lawyer. And then I was just like, can't forget, I want to become a doctor. And then it was my sophomore year in high school. I was 16 years old, and what was a sophomore? It was one of those years. So my biology professor, she came and she told us, she was just like, these are all the fields in medicine that a lot of people don't know about. And it's true, there's so many things you can do in medicine instead of just becoming a doctor.
Yeah, that's one of the main reasons for this podcast, is to bring awareness to a lot of different things that you can do in the medical field that don't revolve around being a doctor or a nurse.
I know. And then that's what kind of intrigued me, because I was just like, oh, well, I thought you had to be a doctor, just go straight and become a doctor. But you don't have to do that. You can become a physician assistant, you can become a nurse, you can be a speech pathologist, you can be an ultrasound technician. There's so many different things that you could do within the health field. It's crazy. And the amazing thing about it, they're always going to need you. So it's you will never get a job.
Quick.
I know. So it was just I was thinking about that, and I was just like, wow, so I don't have to be a doctor, and I don't have to deal with all the blood and all the stuff that you guys deal with. Like, I know as a nurse, you guys deal with a lot, like when it
Yeah,
comes to
we do.
body fluid and stuff like that. And I told myself that I'm like, I could barely deal with myself. So I was just like, I was like, nah, I'm gonna find something where I don't have to deal with that too much. And so I saw the field of physical therapy on the list, and I was like intrigued by it. So for a few years, I was just like, okay, you know, I'm gonna see this. I'm gonna go see if I can pursue this. And it wasn't until it was my freshman year in college, I was like taking classes for my regular major, which was community health. But I was just like, you know what? I want to be a physical therapist. Like, I like working with people. I like the way they work with people. I like the way the field's about. And it's a doctorate profession, so I can still tell my parents I'm technically a doctor. So I was just like, I don't know, it just came to me naturally. And the one thing that I did love about it is that they help relieve people's pain and issues. And I don't know about you, but if you've ever like experienced so much pain and so much uncomfortableness your entire life, and someone gets rid of that for you, or someone helps you throughout that process so it's no longer there, like you're internally grateful for that person
Oh,
because
definitely.
you go through so much just to like with that pain. And when that one person tells you like, oh, that one person helps you to the point where you no longer have to deal with that, like I know it's like that,
It's
like
a big
coming
change.
of
No,
heart
no, no.
touching
You
feeling.
definitely remember the people who help you at that time. Where did you currently have your undergrad?
My undergrad, I went to FGCU.
FGCU.
Yeah.
So transitioning from a school like that, like into a school like that, even smaller, like your school, how was that transition for you?
It kind of brought me back to like high school. Kind of crazy because it's like high school, there was like 300 of us that graduated. And in this program itself, with all the professions that we have, it's kind of like there's 300 people in total.
Mhm.
So it felt nice to see the familiarity of like people's like seeing the same face every day and like getting to know other people from different professions. And I think that's really important because you don't realize how much we all work together until you like literally go in a hospital and you see how we all like send referrals here. We all talk to each other about this. We all get
Mhm.
together in a table and discuss what we find felt like a patient. And I think that's very helpful because like I can go and like talk, like a PA can come talk to me about like, you know, bodily stuff. And then I'll be like, okay, that's interesting. But, you know, musculoskeletal, like, this
Oh
is
yeah,
what's going on
definitely.
here.
You start
Mm-hmm.
to quickly realize how we're all moving pieces to one big machine, which is like the
Mm-hmm.
patient. So what is one thing that you would say that you plan on specializing in, or do you plan on just being a physical therapist? 'Cause I remember we were talking earlier about like the different specialties. One of them you mentioned was neuro. And I remember when I
Mm-hmm.
used to work in the hospital, like there was physical therapists specifically for the babies in NICU, which is
Mm-hmm.
the neonatal ICU, which are like for preemie babies, premature babies,
Mm-hmm.
and things like that. So like, what are some specialties that you know about that you could talk a little bit about? And do you plan on going into a specialty yourself?
Yeah, sure. So there's a few specialties that I can like think about, like the three big ones within like PT, which is neuro, pediatrics, and ortho. Also, a now one that's kind of you talk about a lot more is like the women health pelvic floor or pelvic health.
I've heard about, there's
So
actually a clinic down here that's opening
yeah,
about that.
pelvic health. Yeah.
Have you
So
done
that's like
pelvic exercises?
yeah, it's crazy because it's like something now that people are like gravitating towards that not many people did. Myself, after everything, I still have to do like my neuro, but after taking neuro classes and ortho classes and pediatric classes, I'm leaning towards more orthopedic because I like dealing with like the muscle. I love the laid backness of it, and I love the motions, getting to know your knowing the patient throughout without and like instead of you know you do it like in like a hospital setting and you just meet that person for 1 or 2 times and then you never see them again. Like the whole ortho field, I don't know. I like the feel of that. So I think that's why I'm going to specialize in the future. But pelvic health is mostly dealing with like the pelvic floor. So dealing with people with like urinary issues, incontinence issues,
With mothers and
mostly
babies,
mothers
especially?
and babies, also men. We also deal with men. So we do exercises within that pelvic health area. When it comes to neuro, we basically deal with like brain injuries. So people who have strokes, people who have Parkinson's, people who are, paraplegic. It's just a lot of issues involving the brain, and just teaching that patient to learn how to adapt. Because, when you have a stroke and half of your body's paralyzed, you have to like teach that person how to like
Walk
reach,
again. Mm-hmm.
walk, grab, like the basic things that, we take for granted.
Oh,
So
very
that's,
easily. Because
mm-hmm,
I myself, I have an uncle who who had a stroke, and he had to learn how to get back in a car, like walk up
mm-hmm,
steps, like those
mm-hmm,
things that like people do every day that they're like, oh, like a little stroke. Like they always say, time is brain. Like you let 30 minutes pass by, you might not be able to walk up those stairs anymore. You might not be able
mm-hmm,
to pick up and grasp a phone the way that
mm-hmm.
you do anymore. Like life can change that quickly.
So quick. So if you see anyone that's going through any type of stroke, fast.
Very
Okay. If you don't
fast.
know, you
Yes.
see,
We'll definitely
fast.
post a small little box about what fast is right down here.
Great. Yep. Let them know. But if you see anyone, because as soon as you get them to the ER, so they can like go ahead and get rid of that clot, get wherever the stroke is, the better their chances of rehabbing this. Because if you wait too long, that's when the downhill. Like it takes longer for patients to some people never recover and some people do, but it becomes more difficult in the long run. So it's like as soon as you see them, literally take them to the ER. If they're
Mhm.
suffering it,
Don't let it
right
pass
away.
by.
Mm-mm. But yep, that's neuro. Basically, just teaching them and showing them how to do things now with the condition that they're currently in. Did I talk about ortho? I think I talked about
Yeah, you talked
ortho.
about ortho more so with like people who have hip replacements,
Yep, hip
broken
replacement.
legs, broken arm, broken bones, anything that's a broken
Broken bones,
bone or
or they
ortho,
had surgery. If they had surgery, we can
especially
also
back
help them
surgery,
after
right?
that. Back surgery, anything related to that, we help them with that. We just help them rehabilitate and get back to themselves and get their muscles back to what it used to be, or 95% of what it could have been, and also preventing things. So if you have OA, preventing the time
What
you
is
need to
OA?
go for a surgery. Osteoarthritis.
Yeah, so
Yeah,
it's
so
regular arthritis. And the thing is, what people don't understand, they be like, "Oh, my joints hurt." The only way to help osteoarthritis, you have to move your hurting
you
joints.
have to
Like,
move, yeah. You can't just let that sit because it just gets worse. And that's the thing also with surgery. Like as soon as you're done with surgery, we want you to start moving. We want you
oh
to start
yeah,
walking
they
around
get heart
because
surgery patients up 8 hours after they're out of the operating room. Within
you don't
8
want
hours, they want you
anything.
up.
I don't blame you. I don't blame them because you have to, because you'll start getting clots, things start happening as the more longer you stay in bed. So that's why if you come to the hospital after a surgery, they're releasing people with knee MCL surgeries within 2 days. They're just like, okay, you got to get out, which I don't blame them because we want you to start walking. And then the pediatric is just kind of fun. It's just mostly dealing with babies and dealing with babies with that come in with issues from being born. So
Mhm.
you have the preemie babies, and preemie babies are at risk for so many things later on along the line. So we're just helping the parents and also helping the babies get adjusted to what their new normal is,
Mhm.
because there's so many defects that come in that happens during birth. And you can have a good baby, but down the road something starts happening, autism. Sometimes that happens towards the end. So towards the when the child becomes a toddler, you don't really notice it as a baby, and we can help that parent along that road of oh yeah, your baby has autism. This is what we can do. This is what we can help. If they have Down syndrome, how we can help them with that. If they have a deformed limb, if they're missing limbs, we start them as a baby, and they basically are with us until they're 17. So we're just watching them, doing some rehab with them, also talking and teaching the parents about the deformities that they have and how they can walk around. What's the word? How they can
Pretty much, there's
help
there's
the
there's
child.
a way that they
There you
can
go.
still lead a normal life.
Yeah. So and also I'm telling the parents these are the because we can help them order stuff and type of equipment that they might need in the future, or they might need for the child, so we can help them with that and that aspect as well. So that's pediatrics, and it's pretty fun, especially if you like working with babies and like kids in general.
So do you have any advice that you can give any of the listeners who like want to be a student one day or who want to be a physical therapist one day?
Yeah. So if you want to become a student physical therapist, I suggest an undergrad, just, working your butt off, taking classes that you need to take, become a PT, but also taking those classes seriously because they will really help you in the long run when you become a graduate student.
Mhm.
Especially now in graduate school, seeing how much I did good in undergrad, but like the fact that those classes that I really needed, like there were foundations for me to go into PT school. If I did amazing in those classes, but those classes I can see if you didn't have a really good foundation or grasp on it, it really will hurt you in the long run. So just making sure you practice constantly, study well, find out what your weaknesses are and learn how to make those weaknesses be better within those weaknesses because we have all things that we're not good at, but as long as that we study hard or we work hard so those weaknesses don't show as much, then maybe that might help you in the long run. But yeah, just things, studying, focus, apply. Doesn't matter what school you get into, all PT schools are expensive. So just learn that you're gonna have to spend some money, but apply where you can. Get amazing a lot of recommendations. So speak to your physical therapist, or if you're volunteering, like talk to them, build a professional network. Also, like if you're teachers and all of that, build all those like good interpersonal relationship because you're gonna need those in the long run, especially when it comes for them writing, helping you in the interview. What was it? Helping you in an interview. Yeah, helping you in an interview because I know when I did my interview, they were just like, "Oh, well, this person said this about you, and that's the main reason why I chose you because you seem like a student that that's passionate and driven,
Mhm.
and they really liked you. So if they wrote this strong about you, then I think you'd be a good candidate for this program. So just making sure you network. Networking is really big too. So yeah, work hard though. You'll definitely get in there. If you don't get in 1 year, you'll get in the next year, but you'll do it.
All right. Thank you, Miss Yrline Seraphin, for coming in today.
No
And
problem.
aw, thank you guys for watching. Make sure you come back and follow us on Nay Knows Best and on Instagram at Haitians in Medicine. Bye.
Bye.
Wait.